My name is Dr. Dominic Brandy. I am president and founder of Natural Insights into Cancer. And what we're going to be discussing today is the anti-cancer power of exercise. And it is quite amazing. These are some of the things that exercise does in relationship to cancer. It reduces free radical activity by making your innate antioxidants function more efficiently. Has this amazing epigenetic effect whereby it turns on your anti-cancer genes, stimulates your immune system, reduces insulin resistance, and it reduces tumor growth factors. And there's other ways we're going to discuss. One of the things I strongly recommend everyone to do, especially people that are battling cancer, is to do some kind of resistance training at least 3 to 4 times a week and try to do aerobic activity every day. The reason I stress doing some kind of resistance training is studies show that as we age, we lose significant muscle mass. As, when we get over 50, we'll lose about 1% of our muscle mass per year, and that's pretty dramatic. The reason that's important is that when you lose muscle mass, you develop insulin insensitivity. And that will increase your chances of, number one, getting type 2 diabetes. But the other thing is when you are insulin insensitive, your insulin levels will elevate in your blood. Insulin is a very powerful growth stimulator of cancer. So the lower the insulin levels, the less cancer growth stimulation. So it's really important to incorporate some kind of resistance training. I personally do 15 minutes a day. I hit every muscle group. So it's something you could do at home. It's quick, easy. You jump in the shower and it's done with. Many studies show that if you just do 30 minutes of brisk walking 5 days a week, you can dramatically reduce the chances of getting many cancer. And if you look at these 3 from various studies, it's anywhere from a 10 to 35% reduction in cancer. Breast cancer is especially sensitive to exercise. In this study, just 1 mile of walking daily, kind of briskly, lowered the chances of getting a relapse if you had breast cancer by 24%. Now, if you ran 2/3 of a mile, it decreased your chances by 40%. And then if you were super motivated and you did 2.3 miles of running per day, it decreased your chances of getting a relapse by 95%. I mean, that's almost unbelievable. But you don't need to do that. If you just do 6 minutes of exercise, you will get a 50% increase in the amount of natural killer cell activity. And natural killer cells are the cells that kill cancer. So myself, I told you I do a 15-minute resistance band exercise program. If I'm in a hurry or I just don't feel like doing it, I'll just cut it in half. I'll do 7.5 minutes. And I know that I'm getting, some significant increase in my natural killer cell activity. So I always tell cancer patients, pretend like it's your chemo pill. Would you miss taking your chemo pill? Well, that's what exercise does. I showed you some of the things that exercise does against cancer. Another thing that we know is that when you exercise, it increases oxygen in the cancer microenvironment. And cancer hates high oxygen in its microenvironment. It prefers hypoxia. It also prefers an acidic, inflammatory microenvironment. So, when you exercise, you're increasing the oxygen content. And this study, for example, showed that it decreased the amount of metastasis when this was actually a rat study, when it showed that these rats were put on high exercise programs. Exercise also has a very positive effect on your stress. And this is one of the 5 ways that I discuss in my book. I have a whole chapter on it. But I think any of you that have been in high stress situations, when you exercise, you maybe go out for a run, you just feel 100% better. And if you go through the scientific literature, there are many, many articles that show that exercise, actually works as well as antidepressants. This is one study that was published in Psychiatric and Medicine. They showed that it worked as well as antidepressants as a first-line treatment for depression. This was another study, and like I said, there's many of them in the Journal of Affective Disorders, where they showed that it had a significant impact on depressive symptoms and also suicidal ideation. So, once again, exercise will decrease your stress levels, and that will decrease your chances of getting cancer or fighting cancer. Exercise also has a very positive effect on sleep. If any of you have ever gone skiing, that evening you sleep like a log. So I think we all know that when you're on a regular exercise program, you sleep a lot better. The scientific literature shows that. This is an article from the Journal of the American Medical Association, and it showed that, when you're on an exercise program, you have, better sleep, deeper sleep, higher quality sleep. So once again, make sure you try to get 7 to 8 hours of sleep per night. That seems to be the sleep spot. Last thing I just want to discuss is exercise's effect on cognition. I know many of you might have relatives that have Alzheimer's or dementia, and you want to prevent that, for yourself. When I was in medical school many, many years ago, they taught us that your brain cannot grow new brain cells. Well, nowadays we know that it absolutely can. It primarily happens in what's called the hippocampus. That's an area of your brain that is primarily involved in learning and memory. And studies show, this is one of them in molecular biology and translational science, where they demonstrate that when you exercise, you increase the amount of brain cells in the hippocampus. So in closing, I just want to encourage you all to make exercise part of your daily regimen. It takes willpower, but you just have to realize it's just going to make you a healthier person. You're going to look better also. You're going to have more self-esteem. And you're just going to have a better quality of life if you just learn to make that part of your daily routine. So I hope you learned something, and have a great day.